common disease that we usually encounter in our OP practice, that is acid peptic disease. It's one of the common diseases, as I mentioned. It belongs to a category of disorders, mainly because of the hypersecretion of the acid or because of the disorders that happen because of the acid that produces effects on the lining of either the stomach or on the esophagus. Usually comprises of three diseases, that is, one is gastritis, one is a gastric ulcer, and the third one is gastroesophageal reflux disease. The first one, the gastritis part, is mainly because of the acid that comes in contact with the lining of the stomach, produces an inflammation. That is a little swelling of the mucosa, that is the lining of the stomach, that eventually leads to the gastritis. So the second disease is the gastric ulcer. That happens as a part of this inflammation or the swelling that happens over the gastric mucosa, the lining of the stomach, and it eventually turns up as an ulcer over that area. Ulcer is a break in the mucosa, that is the lining of the stomach that gets broken. The third is the gastroesophageal reflux disease. That happens as the acid that's produced in the stomach reflexes back into the esophagus. That's our food tube. That usually happens either because of the defect in the muscle that connects the esophagus with the stomach, or as a part of the various mechanisms that either happens because of increased pressure in the abdomen that causes the acid to come up and it reflexes into the esophagus. And this happens normally in every person, but when it happens frequently and when it produces symptoms, it's known as the gastroesophageal reflux disease. So how it presents? Usually, most of the people will present as acid peptic disease in the OP with symptoms of dyspepsia. Dyspepsia is a group of symptoms, either happens because of the epigastric pain or feeling of fullness in the abdomen post feeding or having after meals, or an early satiety, means the abdomen gets full after meal. The other part, that's the whenever there is a gastric ulcer, that usually the patient will present with pain. The third is the gastroesophageal reflux. The patient presents with reflex symptoms. That is usually heartburn or a reflex, that regurgitation of whatever we have eaten will come up into the mouth as a sour taste. So these are the usual presentations that the patient may come up with. The usual causes for all these main three group of diseases happens to be one most common cause is H. pylori infection. That usually this is a bacteria that can grow in the stomach. That will eventually produce any swelling in the stomach, inflammation in the stomach that can produce as gastritis or even gastric ulcer from the H. pylori infection. The second most common cause is our lifestyle, the food habits that we usually will not be taking regular feeds. Our food habits will be very irregular. Nighttime dinner will be late. Those kind of lifestyle issues may result in gastritis or gastric ulcer. The third is our habit, like smoking, alcohol, can precipitate all these conditions. And the fourth one is that whenever there's a reflex, that as I mentioned before, it may happen as a part of the abnormality in the lower esophageal sphincter, that is the connecting part of the esophagus, the food tube with the stomach. That happens whenever we get little overweight, that is whenever there is an obesity associated with our issues, then the reflex can be a major factor. So what we do to diagnose all these conditions, an easy way to diagnose all these is mainly from the symptoms. Even if a patient comes with a heartburn, regurgitation, usually the symptom is straightforward, that is a gastroesophageal reflux disease, that we can make without any much investigation. But from the other disease point of view, whenever there's a gastritis or a gastric ulcer, that has to be diagnosed from a procedure known as upper endoscopy. That is we introduce a flexible tube into our foot tube and through the foot tube into the stomach to see the lining of the stomach, if there is a inflammation happening in this stomach, and when there is an ulcer that's being seen in the stomach, we usually document that ulcer through the endoscopy, and we usually do take a biopsy. Biopsy means we take a small piece of the stomach, the little surrounding area of the ulcer or a part that is inflamed. We take a small piece and we do test for infection like an H. pylori, or also we test for any chance of there is any progression to any other much more serious issues like a gastric cancer that can also be seen with the endoscopy and biopsy. And the usual treatment, depending on the cause of the disease, if it's mainly because of a H. pylori infection, we usually treat the infection with antibiotics and for a period of 14 days, and then we usually reassess the patient's symptoms after that. If the ulcer or the gastritis is because of our food habits, we usually tell them to change their lifestyle, their food habits, cut down on the alcohol, stop the smoking. So usually depends on the cause of what's precipitating their acid peptic disease. So this is in short about acid peptic disease, and thank you for listening. Thank you.